Okay, so get this. Today, we are diving deep, deep into the parathyroid glands.
Ooh, parathyroid gland. Sounds exciting.
Right. So I've been looking through these nursing school notes,
Uh,
and let me tell you, there is some seriously cool stuff about these little glands.
cool. In what way?
Well, first of all, they're like the unsung heroes of calcium regulation in our bodies.
Calcium regulation. Okay.
Yeah, and we're talking about like super important stuff here, like how our muscles contract,
Oh, okay.
how our nerves send signals,
Yeah.
even how our blood clots. It's all tied to calcium.
Right. Calcium is essential for a lot of bodily functions. You don't realize it, but it really is.
It totally is. And the parathyroid glands are like right at the center of it all.
So how do they work? Like, what do they actually do?
All right. So picture this. Your blood calcium level starts to drop.
Okay.
Maybe you haven't been eating enough calcium or something.
Mm-hmm.
And these little parathyroid glands, they sense it right away.
They're like little sensors.
Exactly. And they release this hormone called PTH, parathyroid hormone.
Parathyroid hormone. PTH. Got it.
PTH. And get this, the nursing notes have this funny little mnemonic to remember what it does.
Oh, I love a good mnemonic. Let's hear it.
It's PTH, puts the calcium high GH in the blood.
Okay, yeah, that's pretty good. So PTH basically raises calcium levels when they get too low.
Exactly. It's like this constant balancing act to keep everything in check.
Because you don't want calcium levels to be too high or too low, right?
Right. There's a sweet spot.
And what is that? Like, what's the normal range for blood calcium?
Between 9.0 and 10.5 milligrams per deciliter.
9 to 10.5, okay.
And PTH, when it's working right, keeps it right in that zone. But then, of course, sometimes things get a little messy.
Oh, messy how?
Well, our notes talk about two main ways things can go wrong: hyperparathyroidism and hypoparathyroidism.
Okay, so hyper and hypo. One's too much and one's not enough, I'm guessing.
You got it. Let's start with hyperter. Basically, in hyperparathyroidism, one or more of your parathyroid gland.
You have more than one.
Yeah, usually four tiny little things in your neck.
Huh, learn something new every day.
Right. So anyway, in hyperparathyroidism, one or more of them goes into overdrive, producing way too much PTH,
So, too much PTH means?
too much calcium in the blood, which is called hypercalcemia.
Hypercalcemia, and the mnemonic for this one is?
Hyperparathyroid, hypercalcemia, over 10.5. Easy peasy.
Catchy, catchy. But what causes the parathyroid gland to go into overdrive like that?
Well, a lot of times it's a tumor.
A tumor? Oh, no.
Yeah, but it could be benign or malignant.
Yeah.
But basically, the tumor makes the gland pump out extra PTH.
I see. So the tumor is like messing with the gland's controls.
Exactly. But sometimes it's not a tumor. Sometimes it's the body trying to overcompensate.
Overcompensate for what?
Well, like, say you have a vitamin D deficiency.
Ah, okay. Vitamin D is important for calcium absorption.
Right. So if you're not getting enough vitamin D, your body can't absorb calcium from your diet as well.
Mm.
So the parathyroid glands try to make up for it by releasing more PTH.
Makes sense. So it's like the glands are working overtime to get that calcium level up.
Exactly. And sometimes things like gastrointestinal issues or even kidney failure can cause hyperparathyroidism.
Wow. So many things can affect these tiny little glands.
It's crazy, right? And all that extra calcium floating around in your blood.
Yeah. Where does it go? Does it just, like, disappear?
Unfortunately, no. And that's where the problems start. Our notes have this other mnemonic, and you're going to love this one. Ready?
Hit me with it.
Hypercac plus stones, moans, groans.
Stones, moans, groans. Oof, that doesn't sound good.
It's not. So stones refers to kidney stones. All that extra calcium can build up in your kidneys and form those painful little stones.
Ouch.
Then there are the moans, which basically means bone pain.
Bone pain. How does high calcium cause bone pain?
Well, the excess calcium actually gets pulled out of your bones, which weakens them and makes them more likely to fracture.
Oh, wow. So it's like the calcium is going to the wrong places.
Exactly. And then, of course, there are the groans, which, you guessed it, are the gastrointestinal problems, like constipation.
So kidney stones, bone pain, constipation, that's a rough combination.
It is. And those are just some of the symptoms of hyperparathyroidism. There can be others too, like fatigue, weakness, and even depression.
Wow. So how do doctors treat hyperparathyroidism? I mean, it sounds pretty serious.
Well, it depends. If it's caused by a tumor, surgery to remove the tumor or even the whole gland is usually the best option.
Oh, wow. That's pretty intense.
Yeah, but sometimes medications can help control calcium levels, like IV furosemide, which is a diuretic that helps flush out the extra calcium through your urine.
So that's like a quick fix, right? Just to get things under control.
Right. But long-term management usually involves things like dietary changes and sometimes other medications.
I see. So that's hyperparathyroidism, too much calcium. What about hypoparathyroidism? What happens when you don't have enough PTH?
Hypoparathyroidism is basically the opposite of hyperparathyroidism. The parathyroid glands aren't making enough PTH.
So that means
Low blood calcium, also known as hypocalcemia.
hypocalcemia. And I bet there's a mnemonic for this one too.
There is. It's hypoparathyroid, hypocalcemia under 9.0.
Okay, so that's easy to remember.
Hmm.
Under 9.0. Got it. But what causes hypoparathyroidism? I mean, if hyperparathyroidism is often caused by a tumor, what makes the glands underperform?
Well, one of the most common causes is actually damage to the parathyroid glands during thyroid surgery.
Oh, right. Those glands are super tiny and right next to the thyroid.
Exactly. It's a really delicate procedure. And sometimes those little glands can get accidentally removed or damaged.
Oh.
Yeah, it's a risk. But there are other causes too. Low magnesium levels can mess with PTH production.
Huh. Didn't know that.
And there are also some autoimmune conditions where the body's immune system attacks the parathyroid glands.
So it's like your body is fighting against itself.
Exactly. And then the symptoms of hypocalcemia are, well, they're pretty different from hypercalcemia.
How so?
Remember how hypercalcemia can make you feel sluggish? Hypocalcemia actually often makes people feel more agitated.
Really? Why is that?
Well, calcium is super important for nerve function. And when calcium levels are low, nerves can get oversensitive, leading to things like muscle twitching and spasms.
Oh, wow. So it's like your nerves are firing too easily.
Exactly. And in severe cases, you can even have seizures.
That sounds scary.
It can be. And there are a couple of really interesting physical signs doctors can look for to diagnose hypocalcemia.
Oh, tell me more.
Okay. So there's Trousseau sign.
Trousseau sign. What's that?
Doctors inflate a blood pressure cuff on the arm. And in someone with hypocalcemia, their hand will spasm and kind of clench up involuntarily.
Just from the blood pressure cuff.
Yep. Pretty wild, huh?
That is wild.
And then there's Schwastek sign.
Okay, Schwastek sign. What's that one?
For this one, the doctor taps on the facial nerve right in front of the ear.
Okay.
And if the person has hypocalcemia, the muscles on that side of the face will twitch.
So it's like these little tests that reveal how sensitive the nerves have become.
Exactly. They're like classic signs of low calcium.
Fascinating. So how do you treat someone with hypocalcemia? Do you just, like, give them a bunch of calcium?
Well, yeah, basically. But it depends on the situation. Like, if someone's calcium levels are dangerously low, they might need intravenous calcium gluconate.
So that's like an emergency measure to get the levels up quickly.
Right. But for long-term management, people usually take calcium and vitamin D supplements.
To help the body absorb the calcium.
Exactly.
Wow, so we've covered a lot today. Hyperparathyroidism, hypoparathyroidism.
That's amazing, isn't it? These tiny little glands, and they can cause so many problems if they're not working right.
It really makes you appreciate how important they are for keeping our bodies in balance.
Totally. And it shows how seemingly unrelated symptoms can actually be traced back to calcium levels. Like, who knew constipation could be linked to a parathyroid problem?
Seriously, it really underscores the importance of listening to your body and paying attention to those subtle signs and symptoms. They might be trying to tell you something important.
Exactly.
Yeah.
So whether you're a nursing student just starting out or a seasoned healthcare professional, keep this in mind. Calcium is essential. And those tiny parathyroid glands are the guardians of that balance.
Word.
But here's something else to think about. We've talked about how vital calcium is for nerve function and muscle contraction, right?
Right.
Well, what if other health problems, things that seem completely unrelated, are actually subtly linked to parathyroid dysfunction?
Huh. That's a good question.
It is, isn't it? It's definitely something worth exploring further. So as you continue your studies or even just in your everyday life, keep that question in the back of your mind. You never know what connections you might uncover. And that's it for today's deep dive. Thanks for joining us.
Until next time.